And the World Health Organization is warning of a possible COVID surge in Ukraine now. The country's facing critical oxygen shortages as 3 major oxygen plants are closed, making it difficult to treat COVID patients. Joining me now for more on this is WHO spokesperson Tariq Yasharovich with more on this. Tariq, thank you for being here. You know, with the current level of testing and vaccination rates in Ukraine, how bad could this potential COVID surge get?
Well, as you said, the situation is very difficult in many parts of Ukraine, and with the ongoing transmission of COVID-19, it can get even worse because, as you have said, many hospitals are running out of oxygen, which is critical to treat those with a severe COVID-19 disease. We also know that vaccination has been suspended in many parts of the country. So this obviously can make situation even worse. People also are unable to do all those barriers, gestures that we were asking people to do, especially when people are in a closed shelters where there is more risk of a transmission of the virus. So it is really urgent for us to make sure that we provide supplies to Ukraine. Ukraine is running out of medicines, not only oxygen, but for other medicines. The issue really is access within the country and to Ukraine. We really definitely need a corridor so we can move humanitarian supplies and humanitarian workers to help the Ukrainian health system that is under immense pressure right now. We are seeing these images of patients being moved to shelters, women giving birth in bunkers. Heroic work is being done by Ukrainian health workers, but we need to help them.
And how are Ukrainians treating COVID patients amid not just a war, but an oxygen shortage?
Well, as I said, so on one hand, we will probably see less of testing, less of sequencing, less of having epidemiological picture of COVID-19. So Ukraine was going through its 4th wave since beginning of January with Omicron variant. Now, as in other places, the Omicron variant was causing less severe disease, so hospitals were not really overstretched. But what we can see now is that those who really require oxygen, those with a severe COVID, will have a difficulty of being treated, and people will, if they don't get vaccinated, obviously are at a higher risk of developing a severe disease. And obviously this also goes for refugees that are leaving Ukraine. So we are appealing to host countries to provide vaccination for COVID-19, but also for polio, measles, and rubella, as many immunization activities have been disrupted in Ukraine.
And now many of those refugees are leaving in packed trains. They're in crowded environments. Are you concerned about the impact that this refugee crisis could have on COVID transmission?
But we have to really understand that this population is already vulnerable. So Ukraine was going through 2 years of pandemic, and many people have postponed their health interventions because of the pandemic. So health system has been already overstretched. So these people are now coming in countries that will hopefully be able to provide them health services. What is really important is to increase the surveillance for any potential outbreak, and WHO is helping neighboring countries to scale up surveillance and provision of healthcare. It's also important to know that as people will be moving in a very crowded groups and be living in a crowded areas, that we provide water and sanitation to avoid any waterborne diseases. And we should never forget really the mental health component, and hopefully together with neighboring countries, we will be able to provide this psychosociological help to people who have gone through a very stressful situation.
And it will be so needed. Now, in addition to all of the challenges that you just stated, Ukrainian healthcare workers are also going to have to care for people wounded by these attacks, on top of everything else you just mentioned. So how do they do that? And how do people on the outside help with that effort?
Well, what we are really seeing and hearing from Ukraine is that health workers are real heroes here as they try their best to risking their lives to save lives of others. So in any conflict, you will have trauma patients or people who are wounded by explosives. On top of that, there are people who are already in hospitals with other conditions. There was a COVID pandemic. There will be shortages of medicines. So it's really important that we do our best to support those heroic health workers who are risking their lives just by going to work. And they are under immense personal pressure as well, because they are also having their families in conflict zones, and they have to think about their own security, but they still do their best to care for patients. Our job is really to make sure that supplies that we are providing, for example, just today, WHO has provided 39 metric tons that have arrived to Poland today. Now, how to move these supplies, critical to do surgeries, for example, into Ukraine and to those health workers who badly need them.
All right, WJ spokesperson Tariq Yasharovich, we appreciate your time, Tariq, today. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.